the first test in part 2 of these special tests for the neck and shoulders is going to be the Adson's maneuver, or the Adson's test. So what I'm going to have him do is I'm going to have him adduct, externally rotate, and extend his shoulder. So if you could just give me your arm here. So he's going to kind of be in this position, and I'm going to hold his radial pulse right here. Right now it feels normal. And then I want you to rotate your head to the left. Okay. So what this is going to do in a positive test is I'm going to lose that sensation of the radial pulse. He's going to lose pulse. He can relax now. And this will be cognizant of a thoracic outlet syndrome. Second, what we're going to do is he's going to bring his arm up here and kind of into this almost elbow flexion position, and then look the opposite way. Yep. So again, I'm looking at that radial pulse. If I lose the radial pulse or if it decreases, then this is also a sign that he has a possible thoracic outlet syndrome. But this one, as opposed to the first one, is the artery running between the scalenes, or a possible extra cervical rib could be impinging upon that artery, which causes the outlet syndrome. So next, what we're going to do is the military brace position. So he's going to retract his shoulders like this. Okay. And then give me your arm just out to about 30 degrees and then into extension here. And again, I'm looking at that radial pulse. And if you lose the radial pulse, then again, another positive thoracic outlet syndrome. And then this last one for thoracic outlet syndrome is going to be called the Roos test. So I want both of your hands up at 90 and 90. And then you're just going to go like this, close your fists, and then do it rapidly. So we'll do that for 3 minutes. Let's say that 3 minutes have passed. If you lose the sensation or kind of loss of muscle function or something like that after 3 minutes, then that would be indicative of a thoracic outlet syndrome. Okay, one more test. I'm gonna have you lay down here.
Like I was last time?
Yep. So what I'm going to do with this last one, this is called the vertebral artery test. I'm going to slightly extend his neck, put it into lateral flexion, and then rotation that one way. So if there's pain on, what is this, your right side? On his right side, then he's going to feel kind of a shooting pain going down his right arm. And this would be indicative of occlusion of the vertebral artery, of the cervical vertebral artery. All right. We're all done.